Hello, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. We're joined by Jewel Evans. She's a patient who has had both traditional joint replacement and a total joint operation using robotic navigation.
And I'm really anxious to see how they compare from a patient's point of view. So Jewel, tell us a little bit about your story.
Well, I had my left hip operated on July of 2015, and I just had my right one done June of this year.
So the left hip was done sort of without the robotic assistance?
Yes.
And the right one was done with robotic assistance?
Yes.
So you are an experiment.
No, good one, though.
To tell us which one. So can you tell the difference?
Yes. Now I can. I didn't think I could, but yes, I can. The range of motion in my right one came back much quicker than it did in my left one. And to be honest with you, I think maybe the range of motion in my right one is better than my left one, even right now.
Wow. And you noticed that, how long after surgery could you feel the difference?
Well, right away, with the right one, I was able to bend my knee and everything right away. I didn't have a different anesthesia. Was able to move it much quickly.
So in addition to the surgery, some of the changes that they've made in the perioperative pain management, you could tell those different?
Yes.
And the point
yes.
of we're talking about a 2-year difference.
Right.
Where things have advanced so much.
Did you stay in the hospital a different amount of time?
Yes. Last time I was in 2 days. This time I went in on Monday and was home on Tuesday.
Wow, fantastic. Up and walking.
Yes. They have you get up and walk right away with no problems.
So maybe we can go back to the first one, the left one, which was the non-robotic surgery. What was it like when you woke up from surgery? Did you have pain? Did you require pain medicines?
Never had any pain medication with
For
either
either
hip.
one?
Neither one.
Great.
At all.
I find that really amazing.
None. When they wake up, what's your pain level? 0.
That's fantastic.
Was that unusual? I know the other patients get to know each other on the floor.
It's amazing the way the joint replacement unit is run. We do get to know each other because in the morning you have your physical therapy together, and you can see what other patients are doing, whether they had their knee or hip, and you can
having
compare.
this level of pain control is common among the patients?
When I was in therapy the other day, I never saw anybody complaining about being in pain. Maybe a little discomfort, but I never heard anyone complain about being in pain.
So
Tell us a little bit more maybe about some of your, what happened in your recovery. So it sounds like you were seen by physical therapy really very soon.
I was in physical therapy before my surgery, and you have physical therapy twice a day as soon as you are operated on. And then when you released, I had physical therapy every day at home until I went to Dr. Polifrani, and then he gave me my prescription. I went to outpatient, and I go 3 days a week.
Mm-hmm. And you said you could feel the difference in range of motion.
Yes.
What did that mean? Did it mean that you couldn't move it as much because you'd be limited by pain?
No.
Or it just wouldn't move?
More freedom.
So the joint feels more natural
Yes,
to you?
yes. Like one of the PT exercises I have to do, I lay on my stomach and I have to lift my leg. The one that was just operated on lifts higher than the one that was operated on 2 years ago.
That's fantastic.
Just a little bit, but I could feel the difference. And it moves much easier.
And the problem you were having with your hips before surgery, you had osteoarthritis, but was it pain limitation? And what do you like now compared to 3 years ago before either a hip was done?
I could sleep at night and not be in a lot of pain. You could roll over without it hurting. Just the pain level itself is gone. The discomfort, it's gone.
Can you do more activities in your everyday life?
Yes.
Tell us a little bit about that.
I can basically do anything that I want to do now that I couldn't do before. Go in the swimming pool again, swim, do whatever I want to do.
Do you walk? Do you walk for?
Yes.
And what kind of exercise do you do now to sort of keep things humming?
Well, I've been trying to go in the pool to exercise with my physical therapy, and now I just have to work on, I have no steps, so I have to work on going up and down stairs a little bit more. That's all.
Wow.
That's great.
And were your hips, before the surgery, you said you had a lot of pain.
Yes.
Were they also limited in their range of motion? Were you?
Yes. Yes. I couldn't put my socks on. It was hard to, I tie my shoes but leave them loose so I could just slide my feet in. I don't have to do that anymore.
Wow.
I could do whatever I want to do.
And these are going to last, presumably, the rest of your life.
I hope so.
That's what we hope for you.
Yes.
That's what we hope for you.
Does it feel funny having artificial hips?
Not at all. There's no difference.
So you don't feel any difference in the?
None. No.
Do they make any noises that are different?
No, none, none. They don't make any noise at all.
Do you have any limitations now that you have artificial hips that you didn't have before?
No.
So
No.
your quality of life, it sounds like,
Has improved 110%.
You said
That's fantastic.
you said you were having a lot of pain before, and do you have any pain now? or-
None.
So zero discomfort.
From the time you wake up from the surgery, there is zero discomfort.
Yeah, so what advice would you give to somebody considering hip surgery out there?
Don't wait, do it now. I waited a long time to do the left one, which was foolish.
Because you were
Afraid.
Yeah, like,
I was
would,
afraid.
I would be afraid too.
I was afraid to
understand
do
that,
it.
yeah.
And then when the second one, the right one started bothering me, I didn't want to wait this time because I knew with the left one, the recovery was fine. And, in
How
2
about-
weeks, you're up and driving. You're doing everything you
How
were
about when
doing
you
before.
heard that they were going to use a robot? How did you react to that?
My daughter-in-law was more excited about it than I was because she's a physical therapist and she knew it would make a big difference.
So you weren't worried that this was going to be some machine there doing your hip while the doctor, as they said, was having
No.
coffee in the next room.
No, Dr. Palafrani explained it all. And
Yeah, we should point out that the robot is an assistant, so
To
that
the
it's
doctor.
guiding the surgeon's hands in such a way or the surgeon is guiding the robot. So it's just making the tolerances much narrower and more
Yes,
precise
and I
for
have
you.
all the confidence in the world in my doctor. I felt very, very, very comfortable going into the surgery, very comfortable. The classes that
And
he
it
had
sounds
to
like you're
go
pretty
to,
comfortable coming out too.
amazing. I wasn't even worried about coming. I knew it would be fine.
Yeah.
I knew it would be fine.
And so really, if people are worried, you would say, go see a doctor, get some more information, and
I would
consider it.
Anybody I know who's asked me about it, I will tell them to go see my Dr. Palafrani at Norwalk Hospital in their joint replacement unit, because I've talked to other people who've had hips done, especially before I had my left one done, and I was scared of what they went through and their pain levels and how they couldn't move and they were walking with canes a month later, and I never had any of that, none.
Yeah.
Yeah.
And I know that your response is typical because I've just heard so many people who've been through that system, that unit, who have just had spectacular results.
It's amazing. It's amazing. It's life-changing.
And you get home quickly too. It's not even a long hospitalization.
No, next day,
That's great.
and you're
Well,
up and moving.
We so much appreciate you coming on to
thank
share
you
with
for-
our
right,
viewers.
we really
Thank
appreciate
you.
it. Thank you very much for
Thank
coming on the
you.
show and being able to compare pre and post robotic.
Absolutely.
So we'll go with the robotic for the future.
Yes, yes.
I would like to thank our guest again today for coming to share her experiences with us.
If you have a health question for a doctor or something you want to see on the show, please email Andrea and me at healthtalk@wchn.org.
Take care.